occupations to order. As a reminder to members, please turn on your microphones when you are speaking and be sure to mute when you are finished. The one of you that are attending on Zoom, please go through the chair. We have a full agenda today, very important legislation. Madam Secretary, call the roll.
Senator Adams, Senator Buford, Senator Higdon, Senator Hornback, Senator Howell,
Here.
Senator McDaniel,
Here.
Senator Neal, Senator Nemes,
Present in the room.
Senator Thayer, Senator Thomas, Chairman Schickel.
Present, we do have a quorum and are duly constituted to do business. This is meeting number 4. All these items which you are going to hear today on the agenda have been talked about during the interim, some of them numerous times, so none of this is new to anybody. The first item on the agenda, don't think it'll take much time, will be Senate Bill 70, an act relating to, or it's not the first item on the agenda, it's the second item on the agenda, but we'll be taking it first. It's Senate Bill 70, an act relating to diabetes educators. This is simply a name change. We have Larry Brown with the previous administration on remotely. Welcome, Larry. Do you want to tell us what this does in about 2 sentences?
Thank you, Senator. I'll try to be that brief. This was a issue that was raised and caused by the Association of Diabetes Care Educators, who changed their name, and they are the primary provider for certification and continuing education for this group. The board is a 5-member group made up of a physician, registered nurse, a pharmacist, and a dietitian, certified nutritionist, and myself as a citizen. The name change simply better reflects the ongoing certification process and certificates that this organization in DC will be providing them. The big concern.
Is he lobbying for rural broadband, Mr. Chairman?
You there?
Yes. Can you hear me?
Did you just say in conclusion, I thought I heard?
And in conclusion, we simply ask that the name be changed. Thank you.
Thank you. Is
Motion.
there any, I heard a motion from who? Did someone give a motion? Well, entertain a motion. Is there a motion? Motion from Senator
Second.
Nemes, and a second from Senator Thayer. We have a motion from Senator Nemes and a second from Senator Thayer. Any discussions or questions about this legislation? Madam Secretary, call the roll.
Senator Adams, Senator Buford, Senator Higdon, Senator Hornback, Senator Howell,
Aye.
Senator McDaniel,
Aye.
Senator Neal, Senator Nemes,
Aye.
Senator Thayer,
Aye.
Senator Thomas, Chairman Schickel.
Aye. We have 9 yeas on Senate Bill 7. It's passed with favorable expression that same should pass. Larry, thank you for your testimony. Yes,
Thank you, Senator.
Senator Thayer.
If it's in order, motion for consent, Mr. Chairman.
It is in order. Is there a second? Who made the second? We had Senator Nemes made the second. Senator Thayer made the motion. All those in favor use voting sign of aye.
Aye.
Anyone opposed, like sign. Item will be placed on consent. Thank you, Larry Brown. The next item on the that we will handle is the last item on the agenda. It's Senate Bill 78, an act relating to prescriptive authority of advanced practice registered nurses, sponsored by Senator Julie Adams. Senator? You're welcome to. Welcome, as a committee member, welcome. And this is surely not a topic that we've not heard about. It seems like we talk about it every session, so it's great to have you and your people with you. If you would introduce yourself and have your guests introduce themselves for the record and proceed with your testimony. We will be hearing 10 minutes of testimony. 10 minutes of
We'll
testimony.
be quick, I promise.
Thank you.
And thank you. I'm Julie Rocky Adams, Senate District 36, representing Jefferson County. I'm pleased to present to you Senate Bill 78, for which I'm the primary sponsor, and so is Senator Paul Hornback. We have bipartisan support for Senate Bill 78 from our co-sponsors. Senator Hornback and I strongly support this legislation because of our concern that Kentuckians across the Commonwealth do not have access they need to quality health care. I know that advanced practice registered nurses provide that kind of health care because I have seen a nurse practitioner's care firsthand. As all of you all know, we have been dealing with the COVID-19 pandemic since last March, and we are still not out of the woods. One of the things that this pandemic has brought to light is the inequity in our healthcare system, both here in Kentucky and across the nation. If we ever had any doubts about the importance of access to quality healthcare, this pandemic has emphasized and underscored that access is critical, and the easier it is to get care, the closer it is to home, the more likely that Kentuckians will go to see their healthcare provider. We also know that the loss of jobs here often means a loss of employer-sponsored health insurance. We have seen that Medicaid has frequently provided a health care lifeline to many Kentuckians and their families. So we need quality providers who are willing to take Medicaid patients, and we need them in underserved areas, both rural and urban. And we have that workforce in Kentucky, and they are called advanced practice registered nurses. What we are changing with Senate Bill 78 is removing the barriers to health care access by removing the requirement for having a collaborative agreement for prescriptive authority for controlled substances, referred to as a CAPA-CS. After the APRN has had a CAPA-CS for 4 years, and after the Kentucky Board of Nursing reviews the license status of that APRN, only then will they be given final approval. Like all of you, I'm very concerned about the opioid epidemic in our Commonwealth, and I would not be bringing this bill if I thought, for any reason, that there should be that concern that this bill would add to that problem. The CASPR data shows APRNs to be prudent prescribers of controlled substances, including opioids. In fact, the CASPR data shows on average that APRNs are writing fewer prescriptions for scheduled drugs than our physicians in some cases. Like scripts for Schedule II opioids, APRNs are writing less than 50% of the number of scripts that physicians are writing. The CASPR data has good news about the prescribing of opioids by dentists, physicians, and APRNs. From 2015 to 2020, the average number of scripts written by all three provider groups has decreased. The percentage of decrease in prescribing opioids by dentists is 38%, by physicians is 19%, and by APRNs, 34%. We know the importance of medication-assisted treatment for those with opioid addiction, and over 500 APRNs have taken the training and have obtained the waiver to be able to prescribe the medications for this treatment. However, because of the CAPA-CS requirement, we have trained providers who could help address our opioid crisis, and they are unable to provide that much-needed care. So the Kentucky Board of Nursing has the responsibility to oversee and regulate the practice of all nurses, including APRNs. Senate Bill 78 has language that suggests by Senator Givens last session, which strengthens the already strong regulation and vigilance around prescribing that the Nursing Board has in place. Instead of an automatic withdrawal of the CAPA-CS requirement after the APRN has had it for 4 years, the bill calls for a review of the APRN's license by the Kentucky Board of Nursing to make sure that everything is in order with no outstanding complaints or problems before that APRN is authorized to prescribe without a CAPA-CS. The bill strengthens the ability of the Kentucky Board of Nursing to oversee APRN prescribing. And then I want to emphasize that Senate Bill 78 does not increase the number of APRN prescribers of controlled substances or opioids. The APRN, like all other prescribers, must adhere to the provisions of House Bill 1, which was passed in 2012, and House Bill 333, which was passed in 2017. So I have with me Dr. Wendy Fletcher, President of the Kentucky Association of Nurse Practitioners, and Dr. Beth Parton, Legislative Chair, with me to present their testimony.
Thank you, doctors. You have 4 minutes between you all.
Sorry, I tried to read fast.
That's okay. Well, I'm Wendy Fletcher, and I'm a doctorally prepared nurse practitioner from Moorhead, Kentucky. And for the last 22 years, I've been serving patients. I've been serving patients in the northeastern Kentucky area. After 22 years and 5,000 patients, I can tell you that this is a good, safe, and prudent bill. I'm here today to answer any questions on behalf of over 2,000 nurse practitioners represented by the Kentucky Association of Nurse Practitioners and Nurse Midwives. Senate Bill 78 is not unique. It is, in fact, House Bill 286, resurrected from the COVID-restricted legislative session of 2020, where it had over 40 co-sponsors in the House and bipartisan support in the Senate because it was well recognized, as it is again this year, as a bill that centers on improving patient access to research-proven quality health care. And it supports what a year in COVID world has taught us all. APRNs have worked without collaborative agreements under the emergency orders at the federal and the state level, and the proverbial sky has not fallen. Senate Bill 78 is not an expansion of the scope of practice of APRNs, as it does not change an APRN's ability to continue to provide independent clinical judgment or independent decision-making in their clinical practices. We have always, under both federal and state law, practiced independently. Only prescribing has been collaborative. Senate Bill 78 does not change the hard stops already in Kentucky law, restricting Schedule II drugs like oxycodone and long-acting morphine to 72 hours. These limits have been in place since 2006, and with this bill will remain. Senate Bill 78 does not eliminate the requirement to have and to keep a collaborative agreement with a physician for the first 4 years of an APRN's prescribing of controlled medications. Senate Bill 78 does not interfere with any employer or hospital's contractual agreement with any APRN who chooses to sign such an agreement. It also does not change the collaboration between NPs and other professionals who need to be involved in a patient's care. Senate Bill 78 does not increase access to opioids, but it does increase access to NP care. Care by professionals who have proven knowledge evidenced by their education and board certification, their experience, and their actions to exercise great caution and great care in their prescribing practices. Kentucky APRNs have been safely writing prescriptions for non-controlled medications since 1996 and safely prescribing controlled substances since 2006. Senate Bill 78 does not add a new category of prescribers to the mix. Kentucky APRNs have been part of the CASPR program, and according to the most recent data from the Cabinet for Health and Family Services and CASPR, even though APRNs comprise nearly 25% of the prescribing workforce, nurse practitioners in Kentucky wrote less than 0.007% of the total doses of oxycodone, one of the strongest prescription painkillers. But on the other hand, nurse practitioners stepped up and wrote 38% of the doses for harm-reducing, life-saving medications like buprenorphine for those suffering from the opioid use disorder.
Doctor, it pains me to interrupt you, but you're going to have to draw to conclusion.
Okay.
Do you want to conclude for us? How about that?
Thank you.
We're over the time limit, which means we're going to have to go over with the other group also, but please introduce yourself and proceed.
I'll be very brief. Thank you, Senator Schickel and committee members for allowing us to speak today. My name is Dr. Beth Parton. I'm a family nurse practitioner. I practice in rural Adair County, and I own a practice, and it's a health provider shortage area. My practice saw about 7,000 visits last year, and 72% of my practice is made up of Medicare and Medicaid patients. Nurse practitioners who have opened a practice have invested their own money or have taken out significant small business loans to start a business. I had to borrow $125,000 to open my practice. It's expensive to purchase medical equipment, and it can take up to 3 months before insurance companies begin reimbursing for services. Nurse practitioners live in fear that they will lose their CAPA CS because the physician withdraws, charges a fee they can't afford, or moves out of state or passes away. I can honestly tell you that these things have happened to nurse practitioners I know. Losing the CAPA CS means losing the practice. It means patients will not get the care they need. It means an economic loss to the community because staff who's been hired by the nurse practitioner lose their job. And I can also tell you, if I lost my Kappa CS, no local physician would sign an agreement with me. Not because we don't get along or that they don't like me. We get along fine. It's because I'm competition. Senate Bill 78 is not just about prescribing scheduled drugs. It also, you're required to have a DEA number in order to order flu vaccine, injectable antibiotics, syringes, oxygen, and other necessary supplies to run a practice. You also need a DEA number for some mail-order non-scheduled drugs for out-of-state prescriptions. Under current law, Kentucky nurse practitioners must have a Kappa CS in order to get a DEA number. Senate Bill 78 would allow nurse practitioners after the 4-year period to retain their DEA number and order the supplies that they need. My last point is that in the states that have granted nurse practitioners authority to practice to the full extent of their education and training, none of these states have rescinded that or have changed their laws to require a collaborative agreement. So I ask you to please vote for Senate Bill 78.
Thank you for your testimony. Senator Hornback, would it be all right if we would let the other group testify and then do the questions then, or do you need to ask a question right now? Why? But it's your pleasure. Okay.
Do you want
Okay.
us to leave the table, or are they
Not
virtual?
really. I think they're remote, actually, so it doesn't make any difference. So to be fair, let's see, who do we got here? We have Dr. Ron Walridge and Carrie Meadows. Neither of them are strangers to here. Both of them to this committee. Both of them are on Zoom. To be fair, we will give you 15 minutes of testimony. However, gentlemen, you get bonus points if you do not use all your time, because we have a lot on the agenda and we have people that want to ask questions. I would suggest that you limit your testimony to, we've heard a lot of testimony over the years about this, but this is really about the CAP agreement, and I think there's some disagreement over prescriptive authority and the effects this would have. So Dr. Ron and Corey, welcome. Introduce yourself for the record and proceed with your testimony.
Thank you, Chairman Schickel. I'm Dr. Ron Waldridge. I'm a board-certified family physician, practiced in Shelbyville for over 20 years. Served as the coroner here in Shelby County for 10 years and remain as the medical director for EMS services here in Shelby County. And that's what I'm basing my testimony on today. I also am a member for over 20 years of the Kentucky Medical Association, Kentucky Academy of Family Physicians. And on behalf of my colleagues in those organizations, I appreciate the opportunity for me to speak today. I'd like to be clear from the outset that the Kentucky Medical Association and Kentucky Academy of Family Physicians strongly oppose Senate Bill 78 and any other legislative or regulatory efforts by APRNs to expand prescriptive authority related to Schedule 2 through Schedule 5 controlled substances. I'd like to spend just a few minutes highlighting for you the reasons why. As we already know with data, it can be sliced different ways. And with respect to Senator Adams, we have some CASPER data. We went back through 2011. So we went from 2011 to 2020 and looked at prescribing by APRNs during that time. From 2011 through 20, there's been a 393% increase in doses of Schedule 2 through Schedule 5 controlled substances. During that same time, APRN prescribing of Schedule 2 through Schedule 3 through Schedule 5 controlled substances increased by 478%, and APRN of Schedule 2 opioids also increased by 251%. The continued rise in APRN controlled substance abuse or controlled substance prescriptions throughout 2020 is especially concerning. As has been mentioned before, in March 2020, due to the COVID-19 pandemic, we had a number of healthcare providers throughout the Commonwealth who had significantly reduced patient volumes and even closing of offices, as well as many medical facilities. Due to that, those lower patient volumes would have naturally resulted in a decrease in the number of controlled prescriptions by healthcare providers. While this was the result for physicians, During this time, APRN prescriptions increased for controlled substances. One possible explanation is the executive order in March 2020 that allowed the APRNs to practice without the Kappa CS for 11 months now. So we feel like 2020 has offered a preview of what will occur in future years if the Kappa CS is phased out. Removal of the Kappa CS, we must point out, does nothing to increase access to health care for underserved areas. In fact, the Kappa CS does not prohibit or impede APRN's ability to bring their healthcare expertise and care to Kentuckians who live in our state's health professional shortage areas. They have had the ability to treat and diagnose independently and prescribe with a collaborative agreement for many years in any area of the state they choose. However, research shows that APRNs largely practice in the same general area as physicians. Regardless of this, making it easier to prescribe controlled substances would not be considered as a reason to get any practitioner group to underserved areas. Senate Bill 78 strictly pertains to the prescribing of controlled substances, not comprehensive access to care. Senate Bill 78 also phases out this Kappa CS over time, but it also removes the current wait period of 1 year before newly licensed APRNs can prescribe controlled substances. New physicians, upon obtaining their medical degree, will be not permitted to prescribe controlled substances unless they're under the oversight of an attending physician for at least a year. We don't know why we would adopt a lower standard for APRNs. This bill also increases the number of psychostimulants certain APRNs can currently prescribe from a 30-day supply with no refills to a 30-day supply with 2 refills. This is problematic because this was testified before Legislative Committee during the 2019 interim by representatives of the Kentucky Office of Drug Control Policy. The number of prescriptions for psychostimulants is increasing at an alarming rate. The impact on our most vulnerable citizens should also be considered when making changes that allow more prescriptions for controlled substances. Thousands of children and families across the Commonwealth have been directly and indirectly impacted by the effects of the opioid crisis as addiction to prescription painkillers and heroin has swept the state. Oddly, Senate Bill 78 proponents acknowledge the number of prescriptions is increasing. However, they claim is due to the increasing number of APRNs who can practice in Kentucky. If the Kappa CS is a significant barrier to APRN practice, why do we have an increasing number of APRNs that locate or remain in Kentucky to practice? Regardless, this number we feel like is at least about 300 APRN prescribers per year. That has to equate into increased opioid prescriptions because there's no limit on the number of APRNs that can practice in the state. In short, if the Kappa CS for APRNs is removed, it will be even easier for more prescriptions and doses of controlled substances to be prescribed, which I think is the exact opposite of what we need in this time of pandemic. For all these reasons, I respectfully ask for you to oppose Senate Bill 78. Thank you very much, Mr. Chairman.
You're welcome. Thank you, Doctor. Corey, I can't imagine there's anything else to be said after that testimony.
It was excellent testimony, Mr. Chairman. And for the record, I am Corey Meadows with the Kentucky Medical Association. I will allow Dr. Waldridge's comments to be our comments, and I'm happy to assist with any questions that the committee members have.
Thank you for being so gracious. And we do have some questions, and I wanted to get to them because that's the important part. That's why we're here. Senator Hornback.
Thank you, Mr. Chairman. And Senator Adams, I appreciate you and your guests being here today and introducing this bill because I do think, contrary to my own doctor, Dr. Waldridge, who's been my doctor, him and his dad, for a long, long time, and I very much respect their views and opinions. I do think that this does fill a void in Kentucky for those places that don't have proper access to care that we need, especially during these pandemic times. You know, this is, Beth, as you said, it's more than about scheduled drugs. There are a lot of other things that are in this too. And I think in order for our nurse practitioners to properly treat their patients, to be able to do it in a very time when we have a lot of problem with finances and other things and people being able to do it, and what nurse practitioners feel in that void, I think is very good. The one question I had, or a couple questions, and I wanted to make sure everybody understood this, is that, in no way does this, and I know it's of interest to hospitals and individual practices, in no way did this impede any individual practice or hospital from requiring a Kappa CS of that practitioner. Is that true?
That is correct.
Yeah, and in fact, most of the hospitals and individual doctors' practice I've talked to are supportive because it doesn't change their status at all.
And this does not increase the scope of practice in any way. All this is a barrier that, and I appreciate Senator Givens for his request to put in the addition this year that they would be reviewed by the Board of Nursing before they could have that Kappa removed, and I appreciate that. So I think it's a very good bill. I think when in the Commonwealth we need more access to care, I think this is the thing we need to do. And I know that Beth, you had mentioned a lot of times there's the reasons why somebody may not sign a Kappa. Some doc may not sign a Kappa, and I think you said that very well, why sometimes that's not done. So I'd encourage all members to vote for it, and I fully support this bill.
Thank you, Senator Hornback. Senator McDaniel.
Thank you, Mr. Chairman. I've heard the Dr. Online's testimony. I want to hear from you guys. Are we creating a quicker path to prescribing authority without oversight on page 12, subsection G1, by removing the 1 year? Are we creating a quicker path to prescriptive authority for APRNs than MDs?
We are not, because they are already under, as he mentioned, with interns. He's talking about residency interns being under physicians. Nurse practitioners would already be in a collaborative agreement with a physician. So it's already going to remain in place for that 4 years. So no, we do not see that as a quicker path.
Thank you, Mr. Chairman.
You're welcome. Senator Thomas.
Thank you, Mr. Chairman. My question is for Senator Adams. Senator Adams, you testified that nurse practitioners, have not increased their prescription of opioids at the same rate that doctors and other healthcare professionals had. I think you mentioned that they were prescribing at about a 34% rate, to use that term. I'm just curious as to what was the source of your data when you gave your testimony.
Sure, thank you. It's from Casper, and we've both analyzed the 2020 numbers of dentists, doctors, and APRNs, and we've also gone back to 2011. The one thing that Wendy and I were discussing up here is when he used the data, and I forget the exact percentage increase, it was a little misleading. And so I do want to shed some light on that, the data that he showed. But the data that I show, from 2020, you have 1,961 dentists. The number of scripts those dentists have written is 172,000, approximately. So that's 87.8 per prescriber. You have 9,846 physicians in Kentucky in 2020. They have written 2,059,287 scripts. That's 209 per prescriber. And the number of APRNs in Kentucky is 3,782. The number of scripts APRNs have written is 380,771. So per prescriber, APRNs are only prescribing 100.7.
Thank you, Senator Adams.
Thank you. And the last question is going to go to Senator Nemes.
Yes, thank you, Mr. Chairman. This is for Dr. Waldridge. You mentioned that the APRNs are prescribing more and more, but aren't they under the doctor's compact?
They are currently, they have a Kappa CS that would govern the prescribing of the scheduled substances. The House of Medicine in years past have brought forth recommendations to change the Kappa CS to make it a more amenable document to provide oversight. Unfortunately, we've not been met with any success at improving the Kappa CS.
Mr. Chairman, may I make a comment?
Yeah, well, a brief comment. Go ahead.
I'm also not aware at this point that Casper is tracking the physician assistants data. Physician assistants are supervised directly by physicians, so their data would add to the numbers for physicians as well.
Thank you for that. Thank you for that information. We have a motion on the bill by Senator Hornback. Is there a second? Who is that, the second? By Senator Howe. We have a motion and a second. Let the record reflect. We have a lot of business to still do, and so this is one of those issues when I talk to members, it seems like most members pretty well know where they're at, aren't too confused about it. So I think unless there's a question or comment, we maybe can go ahead and vote. Does anyone have an urgent question or comment? Very well. Madam Secretary, call the roll.
Senator Adams. Senator Buford.
Aye.
Senator Higdon. Senator Hornback. Senator Howe.
Aye.
Senator McDaniel.
Cast my vote and explain, Mr. Chairman.
Vote and explain.
I'll keep it brief. I'm going to vote aye, which is different than I have in the past. And I want to make a comment.
Go ahead.
And I don't know where to assign the blame exactly, but the fact is, the level of opioids that have made it into the hands of Kentuckians in the last 15 years has been disgraceful. And the amount of opioids that have made it into the hands of Americans in the last 15 years has been disgraceful. The financial cost, the societal cost, the impact on families is absolutely unstated. And there's not a soul here who can look me in the eye or look anybody else in the eye and reasonably argue that it was motivated by anything other than greed at multiple levels. And I'm not accusing you guys of that, and I'm not accusing these doctors of that, but that's where it started. And it came through a prescriptive process. And I say that to say to you guys, as these are lifted, the state and our society will count on you to not let this go down that road again. We will still be decades cleaning up the mess that's been prescription pain pills in this state and in this nation. And Mr. Chairman, I appreciate the indulgence. We could go on and on and on, but understand there's a tremendous responsibility.
We cannot do that. We
Thank
have
you.
another important bill.
Senator Neal. Senator Nemus.
I'd like to explain my vote, my aye vote.
Vote and explain.
I'm voting aye because I think this needs to go to the floor. There's a lot of things wrong with this situation, not necessarily the bill. First of all, there's too many prescribers, and I'm very, very concerned with that. That's why I was going to vote no, and I may on the floor. The doctors have not done their job. That's why we're here. They're not doing the oversight like they're getting paid for. And as far as worrying about businesses that opened up knowing that that would be an expense and then saying they don't need the expense now, I disagree with that point too. So I am voting aye. Thank you.
Senator Thayer.
No.
Senator Thomas. Chairman Schickel.
No. Senate Bill 78 is passed with favorable expression by a vote of 8-2. Thank you for your testimony, ladies. Congratulations.
Thank you.
Thank you.
You and Schickel.
I felt fine before, and I felt fine then. Hey, we got to get going here. We got another very important bill. That's the first thing on the agenda. It's Senate Bill 15, an act relating to microbreweries. Senator Julie Rocky Adams, welcome again. Introduce yourself for the record and proceed with your testimony. And we are going to go, we have to vote before, if we're going to vote, and I think everyone does want to get this behind us, we're going to have to be very tight because we only have 20 minutes. Go ahead.
Okay, thank you, Mr. Chairman. In your packet, you'll see that there is a PSS1, a committee sub to Senate Bill 15. I'm going to go ahead and just describe what that is briefly for the committee members. As you know, this is not new. We've been, I had a similar bill last session, but we ran out of time, and we also presented before this interim committee in November. Kentucky microbreweries or craft brewers have been a growth industry in Kentucky, and there are over 80 of these small businesses and communities across our state. They're all local entrepreneurs who have invested to create new business and jobs in our communities. Senate Bill 15 addresses industry issues between the craft brewers and their distributor partners. Why is this something that the General Assembly needs to fix? And it's because of the problems we face that are created by and only arise because of existing statutory language. This statutory language primarily was imposed in 2004, and I felt like it was time to take a modern look at what we have been dealing with since 2004. Senate Bill 15 restores fairness, equity, and removes barriers to market, which have been created by existing statutes that the distributor sought passage of in 2004 prior to the craft industry even being a thing in Kentucky. So again, you will hear the General Assembly does not need to get involved and that it should be left to two private entities. So why is this General Assembly needing to fix this? Because it is a problem that was created by us. And so unfortunately, we are the ones who have to fix it. Senate Bill 15 addresses issues that have arisen by this outdated statutory language and the imbalance of power that it has created in this new craft industry. So it amends KRS 243-157 to enable microbreweries to have limited self-distribution privileges that 39 other states already enjoy. And Senate Bill 15 addresses the inequitable imbalances and limited free market that currently is the result of our statutory provisions. So what this sub does is it creates a new section to address the inequities that existed in the current statutory required arrangements. It specifies and makes equal the circumstances in which either party can terminate a distribution agreement. It addresses arising issues from microbrewers being stuck in statutorily mandated contractual relationships in perpetuity. It's called evergreen contracts. And lastly, it establishes a fair process by which a distributor is compensated for the value of the brand they have helped develop when a distribution agreement terminates prior to its stated term. So it is my, and lastly, Senate Bill 15 contains many concessions and adjustments that have been made in an attempt to address distributors' requests. This has been a long process. We have gone to great lengths to try to partner with each side because, as anything goes in this General Assembly, it's better to dance than it is to go on either side. So hopefully we can continue to make progress in this outdated statutory language.
Thank you, Senator, and you're exactly right. Everybody has worked hard, a bunch of meetings, and you're Adam. Good to see you. I know you have testimony, but who else has testimony besides you, Adam? Mr.
Chairman, David Sanford, I'm the Guild's General
Counsel. Okay, well, why, because I want to get the other side on, and then because I know there's a lot of questions, so go ahead. Sure. If you could just real briefly give some testimony. Welcome.
Introduce yourself.
My name is Adam. Excuse me. My name is Adam Watson, one of the owners of Against the Grain Brewery and the legislative chair for the Kentucky Guild of Brewers.
Welcome.
Thank you for having us here, Mr. Chairman. Like many other industry sectors, Kentucky craft brewers are here before you today asking for help in a troubled time. Sure, COVID knocked us down, but what's keeping us down is a law that was enacted in 2004. This is not a zero-sum game, and we're not trying to diminish our distribution partners. Fairness and equity grow the pie for everyone. The existing statute already picks winners and losers, and as the statutorily selected loser, I'm telling you, this bill is a better and fairer way, and it's done surgically rather than just blowing everything up. This gives us tools to make craft beer better for everyone. Every change we've brought before the General Assembly has been vigorously opposed by our distribution partners, but once enacted, has grown Kentucky beer, along with their share of Kentucky beer. This will be no different. So on behalf of Kentucky's 80-plus brewers who wish they could be here packing the room today, as well as the 1,000-plus employees, amongst them the 80-plus employees I've had to let go in the last year, as well as all their families, depending on this bill. Thank you for considering it.
Thank you, Adam, and thank you for keeping your testimony short. David, did you have something you wanted to say, or are you going to answer questions later? Super. Okay. Will the other group then please come forward? If you all would step back, and the ones that want to testify against, come forward. Jennifer, welcome. Good to see you. I am going to say we're going to take 5 minutes of testimony. That's between you two, because I know we have a lot of members biting at the bit to ask questions. So welcome. Introduce yourself for the record and proceed with your testimony.
Mr. Chairman and members of the L&O Committee, thank you for allowing us to be here today. My name is Jennifer Doring. Is this on?
Microphone.
Thank you.
There you go.
I'm the general manager at Chaz Seligman Distributing in Northern Kentucky. I appreciate the opportunity to speak to you about this legislation on behalf of the beer and wholesalers of Kentucky. First and foremost, let me tell you that we are fully supportive of the craft brewers' desire to self-distribute their own products. We understand how difficult this past year has been. Many of our partners have been affected by what has happened, and we are not here to stand in the way. We certainly don't dispute that there have been issues between distributors, and we have oftentimes worked to rectify those. We have been meeting with KGB for the last 2 years and addressing business, industry, and relationship issues. Self-distribution came up in these meetings. We have hosted summits to try to bring all the tiers together. Our concern about Senate Bill 15, as currently written, respectfully and reasonably, we would like to bring it up, is that we want to work together with the KGB, and we all want to walk away with language that we can live with. This legislation specifically deals with self-distribution in the market and valuation, and I will let Mr. Sandlin.
Thank you.
Go ahead,
Jennifer.
Mr. Sandlin.
Mr. Chairman, the members of the L&O Committee, thank you for allowing me to be here today as well, joining Jennifer at this table. My name is Jeff Sandlin, and I'm the General Manager of Perry Distributors in Hazard, Eastern Kentucky, and also PDI of Ashland. Thank you for the opportunity to speak on this legislation on behalf of Kentucky beer wholesalers and distributor tier. I echo all of the open remarks that Jennifer has made. I also have been in the meeting in the groups that Jennifer mentioned over the past couple of years with the Kentucky Brewers Guild to come to a compromise on these issues. I do still believe that compromise can be achieved and stand ready to meet and work out the differences of the KGB. We support the Kentucky brewers in their quest to be able to self-distribute under the law if that is their goal. We have offered language to many of you who have asked for compromise language that would do that. We would work with our brewer partners to help identify the area and accounts that they would like to distribute in. This is not too different from other states and states around us. What is being offered in Senate Bill 15, specific to self-distribution, is not allowed anywhere in the country. Let me repeat. No state allows a brewer to compete and sell beer to the same accounts and retailers as their contracted designated beer distributor partner. The language in Senate Bill 15 would allow a micro brewer to sell up to 30,000 cases of beer a year to any licensed retailer at any time statewide. There are all kinds of issues this causes, from keg deposits, picking up breakage, confusion in the marketplace, chain of custody, a product for recalls, and selling the beer at a lower cost from the local partner distributors, to just to name a few. We are just asking that our partners designate the areas that they want to self-distribute in, be it their home county or their city, Our simple ask is not to cross over in the same markets as their partners. I'll tell you a little brief story.
Well, we
and then
don't
I'll
really
move
have
on.
time for stories.
It's a great one.
Well, we might do it at the end, but
Okay.
I'm really worried
Okay.
we're not going to get everyone's not going to have their
I
say.
want to
here.
touch on the pandemic. So as the pandemic has really affected our retail partners and also our brewing partners. With that said, what the distributor network has been able to do is continue to take their wonderful products to market every day, all day. Thank you.
You're very welcome. Now, it gets interesting. I'm sorry, Senator Adams, you want to stay there or you want to go to the table? Oh, okay. Senator Buford, you had a question or comment?
Thank you very much, Mr. Chairman. Now, I see that 2,500 barrels, from what you said, equates to 30,000 cases. Am I correct?
That's correct.
I mean, I've been in the distribution business before. That seems like a large number of cases, especially if some microbreweries are kind of limited in where their products are being sold. On the other hand, I have concerns with the bill. If we permit the breweries to do this, I think we have opened the gate for distilleries and wine producers to also come in to the courtrooms and say, we should have the same abilities here to treat distributors as this other alcoholic product does. And thus you could have the manufacturer of brands, let's say George Dickel, Maker's Mark, other large brands, if they want to make some distribution, they may be able to. I don't know how you balance out the amount of money. On this 30,000 cases, is the brewery going to send you some remuneration for are they going to give you $1 on the case? Okay, so that's just going in that direction. Well, I think in the 3-tier system, we may be dissolving that with the next court case should this pass, because I think we've got to treat distilleries the same as we do the breweries. I don't see any way out of that as they get into a court challenge. So for that, I have concerns. Thank you.
Thank you.
You may have some comments, or the other side may. Thank you, Mr. Chairman.
Yeah, you're welcome. Senator Adams described her committee substitute. And you all received that committee substitute. It was committee substitute number 1. It was in your packet. And since that time, a lot of the stakeholders have been talking, and I want to move forward. I want to get this behind me. I've been dealing with it for 2 years. So I proposed a committee substitute, which was also in your packet, and it's committee substitute number 2. So you have before you members committee substitute number 1, which is the original committee substitute from Senate Bill 15, and then you have Senate committee substitute number 2. I don't claim to be an expert on this. It's pretty complicated, but I have talked to a lot of people about it. And the way I see it, there's basically 5 issues on the table. What my committee substitute does, and staff has assured me of this, is it leaves everything the way it is in the committee substitute number 1, with the exception of the fair market value of the brand. And it lets, if they cannot come to agreement on that, it goes to arbitration. And I guess I'll stop my comments and see if, number 1, anybody agrees with my assessment of it, and number 2, if there's any further discussion. I was hoping maybe as a compromise that we could do that.
Mr. Chairman,
Senator Nemes.
is it appropriate to move to accept committee substitute 2?
Second.
It is. We have a motion and
Second.
a second to accept committee substitute number 2. And the motion's been made by Senator Nemes, a second by Senator Thayer. Buford. I'm sorry. Okay, thank you for correcting me. The second by Senator Buford. All those in favor use voting sign of aye. Aye. All those opposed, no. Okay, we will do a roll call on Senate Committee Substitute number 2. Whether to accept it or not.
Senator Adams. Did you say no? Oh, didn't say no. Okay. Senator Buford. Senator Higdon. Senator Hornback. Senator Howe.
Aye.
Senator McDaniel.
Aye.
Senator Neal. Senator Nemus. Senator Thayer. Senator Thomas.
Mr. Chair, I'd like to explain my no vote.
Vote and explain.
Thank you, Mr. Chair. And I realize I have 3 minutes. I took this was my last night's homework. And as I was reading this, I really felt like I was reading a typical commercial contract as part of my law practice. It was the first time in my 8 years here that I wasn't sure whether I was reading statutory language or contract language, because the language in both substitutes really read like something that I would read in a contract. And I just don't think that we should be writing contracts in such a statutory language. My feeling is this. I'm supportive of Senate Bill 15. I do think we ought to reduce barriers to entry for business. We talk about marketplace a lot in this body, and I believe in the free market system, and I think the little guy ought to have a chance. And so that's why I'm supportive of Senate Bill 15. I'm sympathetic to Senate Bill 2, but we're only talking about those situations where the amount of product that's being distributed by the distributor on behalf of the microbrewery is less than 5%. That's a very small amount. And since that's being the case, if we can put some kind of cap on that 500% as in Senate Bill 1, I think that seems okay with me, since it's such a small amount of the overall distributor's gross revenues. And so that's how I come down opposed to the second Senate committee substitute in favor of Senate Bill 1, because I do think at the end of the day, we have to give the small microbrewery a chance to succeed, a chance to be in business and prosper therefrom. So I vote no.
Thank you, Senator.
Chairman Schickel.
I vote aye. Yeah, Senator Adams. Yeah. Are you not voting? I vote no. Okay. Okay. On Senate Bill 15, Senate Committee Substitute Number 2, we have 7 yeas and 3 nays, so it is adopted. So now we have before us Senate Bill 15, Senate Committee Substitute Number 2.
Motion to make pass favorably Senate Bill 15 as amended by Committee Substitute Number 2.
There's a motion, which is in order. We will have further discussion. Is there a second? There's a motion and a second. Thank you. Let the record reflect the motion made by Senator Buford, the second by Senator Thayer. Further discussion. No further discussion? Anybody, you want to tell your story? Somebody want to tell a story? We've got a few minutes. Okay. Madam Secretary, call the roll.
Senator Adams. Senator Buford.
Aye.
Senator Higdon. Senator Hornback. Senator Howe.
I'd like to explain my vote.
Vote and explain.
I'm going to vote aye. I don't really like how we're doing this. I understand Senator Adams' point is that we created a lot of these problems. Now we're having to go back and fix them. But I think a greater part of the issue is that the two parties haven't done a good job of sitting down and talking between themselves to work out some of these issues. And we're really in a contract class and writing their contracts for them through this legislation. And I understand that we created some of this issue in 2004, but nothing stopped either side from sitting down and writing a contract. I was blown away that there's no uniform distribution contract in this industry as heavily regulated as it is. All of this stuff that we're dealing is with contract. I don't know that I'm gonna vote for this thing when it goes to the floor. My hope is that both sides are so dissatisfied with what we've done today that they'll actually sit down and talk through the real issues, because I don't think that they've addressed the real issues yet, and that they'll go and address the real issues, and maybe we can address this in the floor amendment. So I'm hoping that that is something that will come about from this, for them to finally sit down and talk up their issues, but I'm going to vote aye to move it.
Senator McDaniel.
Cast my vote and explain.
Yeah, cast your vote and explain briefly.
I'm going to cast an aye vote. I'm going to cast an aye vote for this. I'm old enough to remember when the two of you came to the table and sat down begging us to strengthen the three-tier system. I also am here to recognize we're in the middle of a pandemic, and we're going to argue about how we stock beer on shelves. I'm going to vote aye because this has now been framed as you're either for the little guy who's bootstrapping, or you're for the people who grew their business within the side of the law. I'm going to vote aye because I'll amend this on the floor to get rid of the three-tier system for microbrewers. And we can have that discussion because it's time. Thank you, Mr. Chairman.
Senator Neal. Senator Nemus.
Aye.
Senator Thayer.
Aye.
Senator Thomas.
Mr. Chairman, I explain my I vote briefly.
Vote and explain.
Thank you. Again, I do believe that we ought to eliminate artificial barriers to business. I mean, as I said, this body talks a lot about the free market system, but this vote today is not for the free market system. I'll tell you, you're creating artificial barriers that prevent little people from getting into business and trying to adhere to the free enterprise as we ideally think about it in America. I vote aye because the bill does open up microbreweries to be able to self-distribute, which I'm all in favor of, Senator McDaniel. But this is problematic as we vote today. I vote aye, Mr. Chair.
Chairman Schickel.
I vote aye, and I'd like to explain my vote. Some of the comments that have been made, I want to try to balance those out. I often point this out, but our disagreements in the three-tier system and the microbreweries and all that are a result of successes, not failures. If the industry was contracting, we would be having a totally different disagreement. So I think these disagreements are good. I also think this is a good compromise. A lot of what was accomplished, and most of what was accomplished, the vast majority of what was in Senate Bill 15 was accomplished. It fell a little short in one area, so that debate will go on. I happen to favor the resolution in that one area. But we've had a lot of successes, a lot of great jobs, microbreweries, and all across this industry. So I think it's important to point that out. Senate Bill 15 has 10 yeas, 0 nays. As amended by proposed committee substitute number 2, is passed with favorable expression as same should pass. And we're done right on time. There being no further business, if there's no objections, this committee stands adjourned.